dementia, connecting our lives to help us survive. So we spend our time to the fullest we can.
Hello, and welcome to Professional Insights, sponsored by Dementia Action Alliance. My name is Diana Blackwelder, and I am on the advisory board for Dementia Action Alliance, and I am living with younger onset Alzheimer's disease. Today, I have the extreme pleasure of welcoming Teepa Snow. Teepa? Hi, Teepa. Teepa Snow is an occupational therapist by training with 40 years of highly varied clinical practice. She believes strongly that neurocognitive degeneration, dementia, is one of the most challenging conditions with which someone can live. She believes that lack of awareness, misunderstanding, and task-focused approaches lead to many of the problems in family and self-directed care. Staff-directed care. I'm reading things that I shouldn't be reading. Over the past 25 years, Teepa has actively worked to try to help to change the dementia culture as it relates to providing support and care, and we thank her for that. She also owns Positive Approach LLC, an internationally active training and consulting company. Today, she will do her best to provide those who are living with some form of dementia a better appreciation of the multitude of whys behind the difficulties faced with bathing and showering. So welcome, Teepa.
Thanks, Diane. It's great to be with you guys and talking about a topic that everybody has an opinion about, which is usually care people think people living with dementia are so hard to work with, and people living with dementia think care providers are pretty hard to work with. And what we might be missing is it's actually the thing we're trying to do that's actually a lot more complicated than people think it is. And it's a lot more intensive than we think it is, which is what makes it hard.
Oh, I totally agree with you there, Teepa. To get us started on this topic, can we start with maybe just covering some basics? How do brain changes caused by dementia contribute to showering and other personal hygiene challenges?
Okay, well, let's just say there's actually not anything about your brain changes that doesn't affect your ability to do this. So what that means is for different people getting different kinds of dementia, there are going to be issues in different areas because it actually takes the entire brain working with the entire body to do this thing we called bathing or washing up or cleaning yourself. And it's highly complex. And it's not something you can do easily if things start coming apart. So I'll start with where many people have changes in brain function, which is in the hippocampal regions. And one of the things that happens in your hippocampus is learning and remembering things. Now, the challenge is I know how to take a shower. That is something that most people, I know how to get a bath. I know how to do those things because I've done them a long time by the time you start having brain changes that come with dementia. The problem, however, is that your brain doesn't know for sure whether you did it this time or you did it yesterday, because it is this thing that you do on a routine basis. And so we are so used to following a routine, all it takes is a disconnect, a wire unplugging that lets me know, yep, that was today versus no, that was yesterday. No, actually that was last week. You actually haven't really done that thing that you think you've done. And that's because the other part of the hippocampus that can break apart or not work very well is time passage awareness. And so if my time passage awareness is a little funky, I think it just happened. I think I just did that. So I've already done that. See, I had my clothes on. So my brain goes, well, you took a shower. And it's like, the fact of the matter is maybe I didn't. So if I'm not accurate in my memory of what happened earlier today, earlier from yesterday, because I have to actually remember yesterday morning, not just this morning sometimes. What that means is a way that I could help myself is if I were still tech savvy and I still had some other skills, I could set up audio recording, a visual recording of what I did between 8 a.m. and 10 a.m. If that's when I usually do a shower, I can sort of record that on a regular basis and then listen back and go, crap, I did not take a shower. I thought I had. But it's a rare person that actually reviews their life at that level of awareness. I mean, we assume that we can do it. So that's sort of the first area, I think, where there's this possible disconnect that can really get in our way from routine caring, because we assume we did, but we actually didn't. And then we get a second piece that's in the primitive brain, which is the ability to smell yourself. One of the realities of living with many forms of dementia is your awareness of body odor, your own body odor, the awareness of smells that signal, ooh, you haven't brushed your teeth, the awareness of smells that signal, ooh, you had a slight urinary accident and you are not cleaned up. Those abilities can be gone and you could not know you're missing them. Because it's not like you can't smell. You can smell, but you don't know a problem smell is a problem smell. So your brain doesn't take a hit and go, ooh, that's a smell I shouldn't be smelling. It's just like, well, it's a smell. It's not a big deal. I mean, I'm good, aren't I? I mean, I don't. And so if people, on the other hand, are pointing it out, it can feel very uncomfortable, but it also makes you nervous. So some people will become hyper attentive to this thing, but most people are like, well, if you don't smell anything, why is there a problem? I mean, I would notice if I hadn't had a shower for a week, right? And the problem is maybe not. And I can't be my own best judge anymore. But how comfortable would you be, Diana, if I said, you know what I need you to do? I need to take a whiff with me and see if I smell okay, because I can't tell anymore.
Yeah, I'm not so sure I'd be comfortable with it. Well, that's so you raised so many good points there, Teepa. For starters, just don't assume someone with dementia, just because they can still smell, that they can associate a smell as we need to take an action.
Right.
That's interesting.
Yeah, I mean, because I think that's what many family members and staff members says, can you not smell yourself? And it's like, well, yeah, I smell myself. I'm okay. And there's this sense of how could you think you smell okay? And the thing is, well, my brain is doing a crappy job of letting me know it. I mean, I'm not doing this on purpose. But if somebody says that, I have to have trust in them. And if they were to say it in a more positive way, sort of like, I'm noticing something, I'm not sure if you're noticing it. It seems like you have body odor or mouth odor, and I don't think you know that. And I hate it. I hate that it's happening, but I did think you would want to know that about yourself rather than expose yourself to other people and have them do it. So it does assume a relationship with somebody who's willing to be friendly and say, I don't know if you noticed, it seems to me. What do you think?
So we wouldn't treat the person with dementia like we would treat a young child. We wouldn't tell him, Johnny, you stink, go take a shower.
Right. I mean, do you think that's going to get a kid to want to do something? I mean, it's like, whoa, wait a minute. And our responsibility is different. When I have a child, part of my responsibility as a parent is to make sure that child fits into society. As a friend, I could try, but you have to give me permission. And I think that's the biggest thing that I try to help people who don't have dementia recognize. You can only do things with permission. Your job is to work on getting permission. And permission does not mean, come on, Mom, let me go in the bathroom with you, or Diana, you need help. I mean, it's, Diana, I'm curious, I'm wondering something because I'm getting concerned. I noticed that the trash can isn't getting emptied, and I'm wondering if you're not noticing the smell from the trash can. Or I'm noticing, I know you have cats, I noticed that you're not doing the kitty litter thing. Because what I will tell you is sometimes if we notice an area other than intimate care is also showing some indicators of change, we might be more likely to get somewhere in our conversation if we didn't immediately go to this sense of you don't fit, you're not okay. And talking about either maybe wondering if trash, boy, ugh, that doesn't smell good, or the kitty litter box might be less offensive than saying you smell.
Well, there you go. But there's a difference between cleaning the kitty box and cleaning myself. So I guess we need, so then I guess we need help understanding what action do we need to take to improve.
So if I were a person living with dementia, early on, I would try to find someone that I had a relationship with that I felt comfortable saying, there is a possibility down the road. I'm starting to notice that when you say something smells terrific, I'm not getting that high. And when you say something smells crappy, it's not bothering me. And because I know that, I'm going to ask you to do me a huge favor, which is if you ever notice, I want you to ask me about whether or not I notice, because I don't want it to happen, but I also know it could. So that's the primitive brain. So does that sort of...
Yes, it does. Well, and it raises another excellent point about the person with dementia taking an active role in how can they continue to live their best life by asking for the help of others.
Yeah, I mean, and it may not actually be an issue for me, but if it starts to be, I'd rather have a role in doing something about it than wait for somebody to do something about it and it not be a pleasant interaction. Also in that primitive brain, I would say there's old memories. And one of the things about bathing is it makes us vulnerable. We have our clothes off, our bodies are exposed. If we've ever had an event in our life where we have also been vulnerable, somebody took advantage, somebody forced me, somebody did something to me, that is the time and the place when I'm in a shower, when I'm in a bath, when I feel at the mercy of. It's a very risky environmental situation. It's a very intimate situation. For somebody to come into that without my permission may very well trigger an emotional welling and an autonomic reflex of get out, leave, no. And that's what I think is probably one of the most missed realities, is that by the time you're old enough to have most dementias, you've had lots of life experiences, and some of them were great and you want to relive them, and some of them were not great and you never want to experience them again. So one of the realities we know is that many women, many men have been abused in some way or another. So when we get into bathing or showering situations where somebody else tries to do something, say something, come into that space, or we at least feel like they might, that intensity of emotion, it's called PTSD, or traumatic events from the past, can well up to a point where my brain says, absolutely, I can't get in there. I can't put myself in that situation where I would be that vulnerable ever again. And so part of what's driving the person not to want to shower or bathe is the reality of they've had a bad life experience somewhere, and it comes out in this vulnerable place.
Well, and as you said, we kind of lose our timelines. We don't know if something happened today or yesterday. And so I'm thinking that if we had a traumatic experience in our life, and almost all of us have had something, that could feel just like it just happened and be very disturbing.
And so I'm locking doors. I don't want anybody in here, but then I'm so distressed, I can't actually think of how to do this thing called showering. So I'm going to do it later. I can't do it right now. And so without realizing it, I'm skipping it. And every time I then go in the room, here comes the emotion again. And so it can be place related, it can be time related. And I think that's undervalued. And when somebody's developing dementia, it's hard to articulate sometimes all that stuff because you don't want to be seen as Looney Tunes or crazy or whatever word you want to use. But I know it's not happening, but I can't go in there. And you can't even explain it really to yourself what it is because it's coming from the primitive brain, not the thinking brain.
Well, Teepa, I can really relate to this is just overwhelming. I'm not going to deal with it right now.
Yeah.
I mean, a lot of people naturally do that. But I used to always be the type of person that would just dive right in and will just get it done. And now I'm just the opposite of hard. I don't want to do it.
Yeah, and it's so hard to accept I'm changing. I don't want to see myself as what we call ourselves. Come on, Teepa, just suck it up and get it done. And yet you just can't seem to get yourself to that place. It's just like, and for some people, it has something to do with this part of the brain, which is the sensory motor. So whereas before I could tolerate, when I took my clothes off, the environment was a little cool. The room was, a little bit cool. The fan was on, so the air was moving a little bit. And it was uncomfortable, but I knew that I'd feel good as soon as I got under the warm shower water. But remember, that's advanced thinking. And all my brain is paying attention to in this moment is, this is too cold. The last thing I want to do is get underwater when I'm cold. And so my brain convinces me this is a bad idea, don't do it. And here we go again. I'm back to finding reasons why getting my clothes off and getting in that shower is a bad idea.
So even just a simple tip would be to help the person with dementia with the advanced thinking. This will make you feel good. Not you stink, you have to take a shower, but let's take a shower because you really enjoy it and remind the person that they enjoy it.
Yeah, so one of the things I might do is say, hey, Diana, feel that water. Is that feel about the right temperature? What do you think? So have you turn the water on and feel the warm water? So it's not just even words. I'm actually having you experience the warm on your hand and then give you a towel real quick or washcloth to dry off and say, tell you what. And what we do is we turn the temperature in the bathroom up, or we add a small heater, and we turn off the fan for the duration. Because the last thing you need is moving air. Because when you move air on a human body, you drop the core temperature of the human body.
Wow. This has been so great. We're coming up to time. Are there any other just quick tips that you'd like to just throw out there for folks?
Yeah, I would encourage people living with dementia to start taking a shower with a bathrobe on. Because what you can also experience is the sensation of water hitting your skin can also start to be overwhelming. Get a handheld shower and make sure you start neck down and only do your head last, because wetting your head makes you feel incredibly vulnerable, because once your head is wet frequently, then you could get water in your eyes, you're having difficulty. Added to which, frankly, water is invisible for many people. And so I don't know exactly where it's going to hit me. By having a handheld shower, I'm getting a secondary cue of where the water is going to hit me. By leaving on a loose towel over me or a bathrobe, the water hits the towel and holds the warmth of the water against my skin. And I can come in under and do the high spots, the important spots, without exposing my whole body to the air and not feeling quite so vulnerable. And then I can just drop the wet one and get a nice dry towel when I'm almost done.
That is just some great tips there. It kind of reminds me to understand why some people prefer a sponge bath versus a shower or sitting in the bathtub. Because it's all a matter of sensory experience. It's different for each of us.
Yeah.
And how what's the word, how bashful we are about, exposing
Nobody wants to
ourselves.
be, like if I'm going to keep my clothes on, you take yours off. I don't think so. That sounds really
Right.
uncomfortable.
Right.
Yeah.
I mean, how many people go hang out at a nudist colony by choice?
Oh, not
very
me.
many.
I don't feel that good about how I look without all the layers, over the layers.
Well, Teepa, it is just always such a pleasure getting to interact with you. You're just a wealth of information. I know our dementia discussion is going to love that you're also going to volunteer some of your time to answer some of their questions, not just mine. And we always love having you here, Teepa. Thank you so much for your time.
Thank you for the opportunity and the willingness to talk about a topic most people only want to have arguments about or have fights about. And you know what? We've got to find a better way to have these conversations. So thank you for bringing it up.
Well, thank you again, Teepa. Just to end, I want to remind our audience that this interview with Teepa has been brought to you free of charge because it's sponsored by Dementia Action Alliance, and Teepa has volunteered most graciously her time, as do all of the folks that we interview on Professional Insights. So to see this video and more, please subscribe to our YouTube channel, and we look forward to seeing you online on the Thursday afternoon dementia discussions. Thank you again, Teepa.
My pleasure. Thanks for having me.
Bye-bye.
We're living beyond dementia, connecting our lives to help us survive. So we spend our time to the fullest we can.